Dr. Aston Goldsworthy, and I'm a doctor at Core Medical Center. So if you've been watching our video series, you know this is about how to avoid a total knee replacement. And so this is the third video in our series, and we're going to be discussing some of the treatments that should be done to avoid a total knee replacement. And so let's go back to our scenario from our second video. And if you haven't watched, be sure to check that out. So as we discussed, we have the option of having meniscus removal, right, in this area here, and then a cortisone shot. Well, let's take those things away. So this patient didn't do that. They decided to look at other alternatives besides taking the word of the first person they talked to. Okay? And so what's the first thing that's wrong in this picture when you look at this? What? This here, right? This knee, it's all bent. You know, that's an issue. Well, how do you think it got that way? Well, that's important to note. And so you need to see somebody that can actually assess this and determine how it became that way. And typically what they're going to find, if they know how to do this properly, is that there's some over-tightened muscles and there's some weak muscles that have taken place there. And so those muscles need to be stretched and some need to be strengthened to help pull that back up. But in the meantime, we need to utilize some sort of durable medical equipment or bracing. And so we use what you call an offloading brace. What an offloading brace is going to do is it's usually going to attach to the lateral side of the outside, and it's actually going to pull this down and this up to create space. And so now you can steal some space from over here and put it over there. And so now that joint's no longer bone on bone. Now that treatment alone often reduces pain for that patient. Their pain significantly will reduce just from taking the pressure off that knee. But it should be done a step further. And we'll go into a little bit more detail in our next video on what we're going to do next. But that's the first step. The first step is assessing it properly. The second step is stabilizing that joint. And so assessment and stabilization are key factors in avoiding a total knee replacement. And it's important that you go somewhere where they know how to do that without using drugs or surgery. So thank you for tuning in, and we'll talk about the next treatment that we utilize in combination to effectively treat the knee and keep you from having to get a total knee replacement.